More than 400 healthcare workers at least 4 counties in Kenya have gone on strike demanding better working conditions. The workers are also demanding the provision of personal protective equipment. Kenya's health ministry says more than 16 healthcare workers have died after contracting COVID-19. For more on this, we're joined on the line by SABC East Africa correspondent Sarah Kimani. Sarah, we tried to have this conversation earlier, but technology wouldn't allow for it. Just briefly go back to the context into what is happening with regards to this story.
Well, indeed, the strike has started, and we are outside the Mbagathi County Hospital in Nairobi. This is one of the main county hospitals in Nairobi, so most of the people who would ideally be looking for specialized treatment will come here. Now, some of them are actually standing outside the hospital because they have not been let in. If you had an appointment with a doctor, you're being told that that will now have to be rescheduled until doctors are available again. We do not know how long it will take for them to come back to hospital, because when they were launching their strike this morning, they said that unlike other times when we have seen them on the streets carrying banners, singing songs and making their demands known, this time they have given their demands to the county government and to the Nairobi Metropolitan Services, and because of the COVID-19 regulations, they cannot gather in big numbers, so they will just stay away from the hospitals. Now, what they are demanding, they are saying that the government has neglected them since the COVID-19 outbreak here in Kenya. They're saying they have either received no personal protective equipment, or what they have received has been substandard, and so some of them have either contracted COVID-19 or they have died altogether. They're talking about 15 doctors here in Nairobi having contracted the disease, but they're saying in total across the country more than 838 healthcare workers, whether clinicians, doctors, medical officers, have contracted the disease. Indeed, earlier in the morning, we covered a protest by civil society activists who are demanding that people who may have been implicated in the theft of money meant for COVID-19, for the treatment or for buying personal protective equipment in relation to COVID-19 brought to book. There were just a handful of them, but they were dispersed by police. So those are just some of the issues, and doctors are saying they're heartbroken that money has been allocated to taking care of their needs in terms of protecting themselves and their patients from contracting the disease, but instead it has been diverted to private pockets, sometimes even to people who are not in any way concerned with what is happening in hospitals. So for now, it's only nurses who are operating. The counties that are affected is Nairobi County, which is the main county, the capital center. We understand Nakuru County, Migori County, and also Homa Bay County in the west of the country.
How is the general population feeling about the possibility of not having access to health services?
People are disappointed, they are angry, and that's why there were protests earlier in the day, because Kenya is among countries that have received donations from the Jack Ma Foundation. They have received funds from the African Development Bank, from the IMF, from the World Bank, but much of this money from media reports here and from even investigations done by the Senate here in Kenya is that much of that money has been diverted to private pockets, or equipment that was meant to go to hospitals has actually been stolen and sold to private hospitals, or even sold outside the country. We understand part of what was donated by the Jack Ma Foundation was diverted to Tanzania and then brought again to Kenya by road, where then it was sold to private hospitals. So people are very angry. A lot of them also are disappointed because when the president began announcing the lockdown and measures that he was taking to ensure that the country remains safe, he seemed very dedicated, and the country actually stood with the government. But now many of them are saying they have lost their jobs, they have lost their incomes, livelihoods, some are not able to put food on the table, and yet the country seems to be having a few people who are benefiting from this pandemic. So a lot of people also worried that they will not be able to walk into hospital and receive treatment that they need.
Since we have you with us, Sarah, please just give us the latest numbers in terms of infections, fatalities, and recoveries in Kenya in terms of COVID-19?
Well, the numbers now are climbing. We are talking about more than 27,000 Kenyans who have contracted COVID-19. More than 700 of them have died, and we understand the government says more than 3,000 have recovered. The country has been very robust in introducing home-based care because the hospitals, like the one here behind me, which is one of the specialized hospitals with an isolation facility for COVID-19 treatment, is already overwhelmed, and so they are preferring to have patients receive home-based care, and that has been very successful. So a lot of the discharges we are seeing actually are coming from home.
Thank you so much for that update, Sarah Kimani, coming to us from Kenya.